Dr. Brent Wallis joins us now, Chief Medical Officer of People's Health. February is Heart Health Month. As more people are surviving heart attacks but being left with weakened hearts, heart failure is a major cardiovascular disorder on the rise that affects nearly 5.8 million Americans. Dr. Brent Wallis from People's Health joins us now to discuss. How are you, Doc?
Hey, Tommy, I'm doing great. You doing okay?
I am fine, sir. Tell me about heart failure. What is heart failure?
Sure. So heart failure, it's a scary word, and a lot of people think of heart failure as something that happens immediately or sudden, kind of like a heart attack. But the two are completely different. A heart attack is something that comes on suddenly and often is associated with pain, but heart failure is more something that comes on slowly, very insidious. It's the result of a progressive weakening of the heart muscle. And just like any other chronic condition, it develops slowly and it gets worse over time. But the best way to think about heart failure is really it's when the heart itself cannot pump the blood around your body. And obviously your body needs that blood to function. And the reason it can't pump is because the heart muscle itself becomes too weak. And it may be the entire heart muscle or a part of that heart muscle. And so what happens is when the heart muscle is damaged, the rest of the muscles have to kind of jump in and pump the blood a little bit better, and then that slowly kind of progressively causes weakening of the rest of the heart. What's really important about heart failure, though, to remember is, it's not a death sentence. A lot of people get very concerned about that word failure, but really people can live with heart failure for a very long time as long as they're seeing their doctor and following directions and taking care of themselves. In fact, millions of people live with heart failure every day.
What causes heart failure?
Yeah, heart failure is really caused by another disease, usually a chronic disease. Something like diabetes, for example, can increase your chance of getting heart failure by 2 to 8 times. And actually, women who have diabetes have an even greater risk than men for developing heart failure. But really, there's a lot of things that can result in heart failure. Heart attack, like I mentioned, is one of the most common causes. So if you damage a portion of your muscle, it's going to have a harder time squeezing. Some people have heart arrhythmias or an irregular heartbeat. That irregular heartbeat makes it difficult for your heart to squeeze, and so that can result in some problems. Probably the most common thing we see, though, is uncontrolled high blood pressure, and it's why we're, so vigilant about checking your blood pressure and making sure you're taking your medicines, because the longer your blood pressure goes uncontrolled, the more the heart can be damaged and stretched out. And then a couple of other things we always look for, are the valves in your heart working correctly, because that can cause problems. A lot of people, as they age, your heart muscle ages as well. And so as you get older, your incidence of heart failure increases. In fact, heart failure is actually the most common cause of hospitalization in our senior population. And then the last one to keep in mind is it's not just heart attack and chronic disease that can cause it. Heavy alcohol consumption can actually lead to damage to your heart as well. So keep that in mind. There's really not just one single risk factor. It's a whole bunch of things combined together that increase your risk for developing heart failure.
What is it about alcohol consumption that damages the heart?
Yeah, heavy alcohol consumption actually damages the cells within your heart muscle. And what it does is it causes the heart sometimes to stretch out, kind of become like a stretched out balloon. And because of that, it can't snap back and squeeze the way that it's supposed to.
What are some of the symptoms of heart failure?
There's a lot of things that heart failure causes, and the issue is a lot of them, like I said, come on slowly, so people may not really realize what's going on. They may chalk it up to normal signs of aging. But what we look at is we look at a couple of different areas. One in particular is fatigue. Getting tired, not being able to do the things you used to do, or if you exert yourself, really feeling exhausted, that's a sign you want to get checked out. Being limited in your activity, some people will actually stop exercising or feel weak when they just try to walk around, so that activity level is really important. And then chest congestion, because your heart is pumping blood out of your lungs to the rest of your body. If it backs up, you're actually going to develop cough, chest congestion, and probably shortness of breath as well, which is another key symptom. And the last one we see, again, which is because of backing up of all of that blood in your body, it's going to back up into your legs. And so a lot of people will develop really severe edema or swelling in your ankles or even all the way up to your knees. If you see any of those symptoms, that's something you want to talk to your doctor about right away, because they could be signs of heart failure.
Let me take a break. We'll pick it up here. We come back, and we'll talk about some steps you can take to manage heart failure. It's Thursday morning, Heart Health Month, surviving heart attacks. But being left with weakened hearts, heart failure is a major cardiovascular disorder that's on the rise, and it affects nearly 5.8 million Americans. Dr. B from People's Health is going to continue when we come back. 8:20 now, time for traffic on WWL. 8:24, Tommy Tucker, WWL. Talking to Dr. B, Dr. Brent Wallis from People's Health. February is Heart Health Month, and we're talking about heart failure this morning. So, Dr. B, what steps can you take to manage heart failure?
Well, there's a lot of good news for the millions of people that live with heart failure. We have all kinds of treatments that we can provide now. And some of that starts with medications. So we do have a lot of medicines that can directly help your heart pump better. But in particular, like I mentioned, you want to keep your blood pressure under control. So, when your doctor checks it and they say it's a little bit high, it's really important to make sure that you're taking your medicine as they instruct, because that's going to help you in the long run. One of the things I talk to people a lot about is really watching your symptoms, though, because if you have any of those symptoms, the shortness of breath or the swelling and that fatigue, you really need to talk to your doctor about it, especially if something is slowly getting worse. Your medications may need to be adjusted, or they may need to do some additional testing to see what's going on. What is really, really critical in congestive heart failure, though, is watching your diet. So in particular, salt intake. And we have a big problem with this here in Louisiana. Salt actually makes you retain fluid. So the more you build up fluid, the harder your heart has to work. And so that's going to actually make your symptoms worse, but it could also make the heart failure worse in the long term. So it's really important to eat a low-salt diet or a low-sodium diet to keep your heart failure under control. And one thing I tell people to really watch is their weight, because as you retain fluid, your weight is going to go up. So anybody with heart failure needs to make sure they have a scale that they can hop on every morning and make sure that they're not putting on extra weight. And then the last thing I'll kind of mention is exercise. We talk about exercise. It's very good for your heart. But with heart failure in particular, you definitely want to talk to your physician before you start an exercise program, because you don't want to do anything to stress your heart too much. So they really need to assess what you're capable of doing, and they'll help you design an exercise program that's right for you.
How can people find out more about People's Health?
Yeah, we have a lot of this information posted on our website, so you can always go to peopleshealth.com. But we've also got our People's Health Medicare Center, which we opened last year. It's right on Veterans, next to Party City, right at Causeway. You can actually walk in, or you can call us for an appointment. There's people there that can talk to you about this and anything else you have questions about, especially around Medicare as well.
And you can call 1-800-978-9765. You can also follow People's Health on Facebook, Twitter, and Instagram. A couple extra minutes, Doc. So let me get questions here that have come in. Can viruses cause heart failure, and not necessarily just viruses like COVID?
Yeah, definitely. So there are certain types of viruses that can result in something called cardiomyopathy. And cardiomyopathy is an infection within your heart that can cause dilation and stretching out of the heart, and it can present very similar to these heart failure symptoms that we're talking about. So, that too can be treated and it can be managed, but it is something to keep an eye on, keep an eye out for, especially after you've had a viral infection.
Can heart failure damage/symptoms be reversed through nutrition and cardio exercise?
Yeah, they definitely can be improved. You may not be able to completely eliminate the heart failure, But certainly a proper exercise program can help to make that muscle stronger. So that way it's going to actually squeeze better. And then nutrition is really critical, making sure that you're eating a diet, again, like I said, low in salt is really important, but also making sure that you're getting plenty of antioxidants, fruits and vegetables is always going to be healthy for you, but it's going to also help other conditions like diabetes and high blood pressure as well.
I thought a tad bit of wine is good for you, says this text, because of antioxidants, and I heard it lubricates the heart.
I don't know if it lubricates, but wine certainly can be beneficial in moderation. The thing I always tell people is anything that you do in excess is probably not going to be good for you, but a little here can actually be beneficial to you as well.
And what about vitamins that are good pre-heart condition? What should people be taking for their heart health?
Usually, in the United States, we have pretty good diets, and so supplemental vitamins are not always necessary. But you can talk to your doctor because sometimes there are some tests they can do that may point out a deficiency that you need to take a multivitamin for. But beyond that, I probably wouldn't get into a whole lot of the supplements without talking to your physician.
Doctor, I appreciate it. I hope you have a nice Mardi Gras. You dressing up this year or not?
Yeah, definitely. I'm going to be riding on Saturday. I'm very much looking forward to it. Yeah, crew of Tux.
Wow, good. I was a Grand Marshal of Tux one year, believe it or not. It was an honor.
Yeah, I remember that.
Oh, thank you, Doc. Have a good weekend and enjoy your ride, okay?
Thank you. You too.
Hail Tux. All right, 8:30 now. You can go to peopleshealth.com or follow People's Health on Facebook, Twitter, and Instagram. Time now for WWL First News, and for that we go to Dave Cohen.